Now, usually you have thin K-wires, but if there is a thick K-wire and you have a student who has not studied his lessons properly, you may have a confusion between this and this, but not when you look closely. Just look at the K-wire. The K-wire is perfectly cylindrical and it has got a tapered end. However, this is not only not a perfect cylinder, it has got a cross section which is a square. Therefore, something that is square and has a taper is an ulnar nail, and something that is round and has a taper is a K-wire. Remember that the K-wire is again very similar to the K-nail, only in the way that both start with a K. The K in the K-nail stands for Kunscher, and the K in the K-wire stands for Kirschner. The inventor of the K-nail is Gerhard Kunscher, and the inventor of the K-wire is Martin Kirschner. Please do not confuse Kunscher and Kirschner, even though this is a K-nail and this is a K-wire. Both of them have got totally different inventors. Now, there is another instrument which looks like a huge K-wire. This. And this is the Steinmann pin, universally used for skeletal traction and sometimes, very rarely, in operative procedures. This looks very much like a huge K-wire. The Steinmann pin also has a beveled edge and it is very similar to the K-wire. But when you look at the end, the posterior surface, you find that there are 3 notches. These 3 notches are there so that you can grasp them easily with the 3 jaws of the chuck inside the drill, and therefore you know that this instrument is used with a drill preferably, though some people do prefer to use a mallet on this side. This is the Steinmann pin. The Steinmann pin is used for skeletal traction. The skeletal traction is a traction which is applied to any of the bones in the body to reduce fractures, to reduce dislocations, to give rest to that part, to reduce the pain, and in some cases skin traction can be used to immobilize that particular patient. Forced immobilization, not skeletal, skin traction. These are the various indications of traction. The Steinmann pin is not simply tied to a rope on the traction kit. The Steinmann pin comes along with another instrument called the Bohler stirrup. This is the Bohler stirrup. Once the Steinmann pin is fixed onto the bone, it is then connected using the Bohler stirrup. Now let us see how the Steinmann pin and the Bohler stirrup are used in a certain bone. This is the lower part of the femur. Classically, the Steinmann pin is used in the upper part of the tibia. However, for illustration purpose, I will show you how the Steinmann pin is used. It is inserted from whichever side the nerves are most accessible. Why? Because if you access it from the side on which the nerves are there, you know that you are missing the nerves. However, if you insert it through the opposite side, you cannot control the exit, and sometimes it may come out and injure the nerves. So, the thumb rule in any part of insertion of a Steinmann pin is on the opposite side of the nerve. For example, if you are inserting a Steinmann pin on the upper part of tibia, you have to miss the common peroneal nerve, and therefore you put it in through the lateral side and it comes out medially. However, if you are putting it through the lower part of the tibia, the neurovascular structures are medial, and therefore you put it from medial to lateral. And what about calcaneum? Same. Again, the nearest neurovascular structures are on the medial side, and therefore you put from medial to lateral. So, the Steinmann pin is introduced through the bone, and it stays so, and you bring the Bohler stirrup and you fix the Steinmann pin like so. Now, what is the importance of the Bohler stirrup? You can see that the Bohler stirrup consists of a small screw here and a small part here which is mobile from the rest of the Bohler stirrup. Now, when the patient moves, there is a chance that the femur or the tibia will move like this. Each time the Bohler stirrup or the bone moves in either side, there is a possibility that your skeletal traction will become loose and finally it will play around. So that is why the Bohler stirrup was invented. Once the Bohler stirrup is fixed firmly to the Steinmann pin, when it rotates, you just look at this part. When this part moves, this part remains stable. You can see it very carefully here. Therefore, when the patient or the traction moves, the Bohler stirrup moves, but the Steinmann pin does not move, and that is why people prefer to use a Bohler stirrup for the traction. So you can see here that the Bohler stirrup is moving, but the Steinmann pin is not moving. Suppose this is an old lady. These people have got severe osteoporotic bones. So in these cases, if you insert an ordinary Steinmann pin, there is every chance that on the first week itself, you will have something that moves around. This is not desirable. For this reason, we have got another instrument which is called the Denham pin. The Denham pin is very much similar to the the Steinmann pin, but it has got a thread in the middle. Now if you look carefully, you can see that the Denham pin has got threads in the middle. Now, the Denham pin is again inserted similar to the Steinmann pin, but you always have to use a drill for the Denham. It is introduced like so until this part, and then it goes inside by turning. That is, a Denham pin can be inserted or removed only by a drill. The third instrument, which is very commonly mistaken for either of these, is the Shan pin. The Shan pin is used as a set for the external fixator. The Shan pin also looks very much like a Denham or a Steinmann, but the Shan pin has got thread at one end. The Shan pin is used for external fixation, and very rarely you can give traction on it in case of fracture dislocation of the hip. But you can see very nicely that it has got threads at one end only. The Denham has got thread in the middle, and the Steinmann pin has got no thread at all. This is the difference between each of them. Now, how to remember which is which? There is a mnemonic. Just remember the end letter of each. Denham ends with M, meaning that it has got